The U.S. military is standing by to move hundreds of millions of vaccine doses once they're approved.
Within 24 hours.
The FDA's Vaccine Advisory Committee is set to meet December 8th to talk about COVID-19 vaccines. The federal government prepaid drug companies for hundreds of millions of doses. Enough to vaccinate 20 million people is already in storage. Pfizer says its vaccine will ship domestically from facilities in Michigan and Wisconsin, but it must be kept at nearly 100 degrees below zero before it's thawed and administered. In Philadelphia, the Department of Health is preparing for the Pfizer vaccine to arrive first.
It's geography, and because we're a city where we can drive vaccine where it needs to go.
The shipments will come in these dry ice boxes holding 1,000 individual doses. Today, the Philadelphia Department of Health installed 2 ultra-cold freezers where it can store and hub up to 320,000 vaccinations.
If Mercy Hospital or any hospital in the city says, we ran out of doses, we wanted to be able to dip into our own freezers and drive them out there so we don't hold anyone up.
The way we vaccinate will have to follow social distancing and public health safety protocols. While there's not yet a system to sign up for an appointment, there will be.
This will be appointment driven across the entire city because we do not want to create long lines.
The first vaccinations will go to doctors, nurses, first responders, and nursing home workers. Then people of all ages with 2 or more risk factors. Phase 2 covers teachers, school staff, child care, and food supply chain workers. Phase 3 opens vaccinations to children and young adults 30 and under. Phase 4 covers everyone. The Department of Health and Human Services believes it will have enough vaccine for every American by April.
Mitch joins us now from our Montgomery County Bureau. So you detailed how the vaccine gets to Philadelphia. What about the suburbs and the more rural areas?
So, Tracy, that's where having multiple vaccines that are viable becomes valuable. The storage temperatures for Pfizer's vaccine, it makes it hard to distribute too far from those really cold, those ultra-cold freezer hubs. So when the vaccine is thawed, that vaccine, Pfizer's vaccine, it has to be administered within a few hours, and that limits the range. So while in Philly and its direct suburbs, it can make that ultra-cold logistical situation work, more rural Pennsylvania, some of South Jersey, and parts of Delaware may end up relying on a vaccine that is much more mobile. And Moderna's vaccine, it doesn't have to be stored at such cold temperatures, so we could actually see urban and rural Americans get 2 different vaccinations, Tracy.
Right. All right, Mitch, thanks so much. Appreciate it.